Hello, my name is Dr. Kim Schunkweiler, and today is May 10th, 2012. And I want to share with you a little story about a little experience I've had recently concerning pulse electromagnetic field therapy. I've been using PEMF in my practice for nearly a year, and just about a month and a half ago, it came home and I had a personal experience. And I want to share that with you. At the end of March, I made a trip down to Florida to represent PEMF at a conference down there. I got a scratch, a bite, something right here on my face, and it got infected. I came back and it spread really quickly. It spread from here and just started taking off. I tried many things, but it was spreading so fast I went to see a friend of mine who is an osteopath, put me on a drug called Cipro. It was cleaning up my face, and after about 3 days on the drug, that I came to work. It was a Saturday morning, about 8:45. All of a sudden had the most intense pain I've had in my entire life. Took me right down. I turned white, started sweating. My wife took one look at me. She called the EMS. They came to the office, checked me out. My vitals were good. My heart rate was really low though. And the EMT said to me, he said, "Sir," he said, "I don't know you, but you don't look good." So we're going to take you in. So off we went to the hospital. The docs were waiting. When we got there, they had a hard time believing I was 61 years old and wasn't taking any medications of any type other than the Cipro. But they did blood work, and they were again amazed that all my cholesterol was good, and my blood sugar was perfect, and my liver enzymes were perfect. Then they checked my pancreatic enzyme level. It's an enzyme called lipase, which normally runs somewhere, depending on the scale, from 65 to maybe 400. And my lipase was 48,000. Doc comes in, he says, "Well, we know what it is. You got pancreatitis. So here's the treatment plan," he said. "You will probably be here a week, probably more. Nothing by mouth. You can't even have ice chips. Everything IV." So, and pain meds. I tell you, the pain was really bad. They tried morphine. Morphine didn't do much, and they went right to Dilaudid, which worked really good. So they put me up in the room, and as soon as I got up there, which was early Saturday evening, I said to my wife, I said, "Go to the office, get the machine." So she went and got my PEMF machine, and I started treating myself that night. Next morning they came in, drew blood, and came back, told me my lipase level had gone down from 48,000 down to 4,600, which was a pretty significant drop. The next day it was 850, and Tuesday morning it was 275, and I came home. But that's the short version of the story, but a few things happened in the meantime. And I have a very special person here with me today that I want to tell you her side of the story and share with you a couple things that transpired while we were in there. So I want you to meet Melissa Cherry. She was my nurse, my angel Mercy, who took care of me while I was in there. And here's Melissa. Maybe first of all, Melissa, hello. Maybe you could kind of share what you saw of me as a patient when you first maybe took a look at me or my chart.
Exactly. Well, as his nurse, I had to review all of his lab work and his condition and what was going on with him. And when I went in to meet him, I introduced myself and noticed that he happened to be using this machine on his abdomen. And I was curious, and I'm a little nosy, so I asked him to tell me what was going on there, what he was doing. I wanted to know what this machine was, and he was kind of twitching a little bit, and I kind of wanted to know what was going on. And so he proceeded to tell me.
It was funny because I said, I've treated all kinds of things with this. I answered some of the technical questions, and I said, I've treated everything from autism to zits to back pain to Parkinson's to MS. And at that point, she stopped me and she goes, "I have MS."
Yep.
And at this point, I think you just given me a pain med about 5 minutes earlier.
Not too much earlier.
And that stuff kicked in pretty good, and I'm kind of like this, you know. So, and the machine stopped working, and she filled me in a little bit about things going on in her life and how it had affected her. And I said, you know what, why don't you sit in that chair over there and you're going to treat yourself. I think she said, really? It's kind of weird. Well, what the heck, it's 3:30 in the morning, and
Why not?
Why not? So I had her sit in the chair. She took the loop from the machine and put it around her neck, and I said, well, we set the timer for 5 minutes. We set the intensity, and she hit the green button. I said, when it goes off, hit it again.
Yep.
At which point I kind of went like this.
Yep.
So I heard the machine running. I may just back up a little bit, because what you had told me was that you were kind of scared because you couldn't feel your fingers, and
I haven't had feeling in my fingertips in 10 years,
yeah,
at least.
and
They're numb, nothing.
Right.
And because of that, I do this a lot, just to test my fingers.
yeah.
I can still move them, had full function of them, but there was no feeling in them. If you stuck me with a pin or something, I wouldn't feel it.
And maybe was it starting to affect
Motor skills
Motor
and
skills.
fine motor skills. Oh, absolutely,
Yeah.
absolutely.
So she treats herself. I heard the machine go off, then it start running again, and 5 minutes later, I guess it could have been an hour, I don't know, but I heard the machine go
It
off.
was 5 minutes.
And I opened my eyes, I looked over, and Melissa's sitting there, and she's going like that, and she touches her leg, and touches the side of the chair, and she looked up at me, and she had tears coming down her face. And that's when you came over, and she just gave me
Gave him a big giant hug.
a hug, and
Big giant hug.
said, I haven't been able to feel my fingertips in 10 years.
10 years.
And then she could, after about 10 minutes.
10 minutes with this machine. And we talked a little bit more about my condition and problems that I've had, and he said, well, when you get off work this morning, come back in here and see me.
Yeah, I said, don't go home without getting treated again. So,
And I didn't. I came back and I saw him 7:30 that morning when I got off shift, and treated the lower half of my body, and did some work there, and I proceeded to tell him that he was going to have a client for life. And I was going to tell him that he needed to hurry up and get well and come back to the office because I needed to come in and see him.
and that she did.
And I've been here every week since.
Yeah, and she's doing pretty good.
I'm doing
Maybe you could tell me
fantastic.
what you've noticed since we've been getting treated.
Yeah, absolutely. The biggest thing is my hands. I used to have fine tremors just a little bit. I don't have that anymore. I have complete feeling in my fingertips. I have more control over my hands than I've had in at least 10 years. I'm 35 years old now. I was diagnosed when I was 22, and was diagnosed because I was having all kinds of really weird, numb, tingling problems walking, problems speaking. I would be at work and I would be writing and my hand would just drop a pen. I couldn't control my fine motor skills whatsoever. And it was a big problem, and it went on for probably 2-3 months, and finally went to see a doctor, and she diagnosed me with MS, and went and got a second opinion. I quick fast had 2 kids after that, and for probably the last decade, the last 10 years, I've had off and on problems with my MS. One of the biggest problems that's been a huge factor in my life is that I have had no feeling in my fingertips whatsoever. They are completely numb. I had very hard time with fine motor anything. I mean, threading a needle, forget it. Thank goodness I'm not a seamstress. Things like that. I also have a lot of pain in the lower half of my body. Uncoordination. I have a big problem with being uncoordinated, and so it's been an issue. It's been a huge issue, and through a series of events that happened to me at work, I'm a nurse, and through a patient that I had treated, I was introduced to the PEMF machine, and it has changed my life. dramatically, and I can tell you that it changed my life in the course of 10 minutes. I had this experience with a patient who was using the machine. It happened to be his personal machine, and I questioned him about it. We talked a little bit. He shared with me some testimonials, and I shared with him that I had MS, and he immediately said, "Let's treat you, let's do it, let's see how this works." And okay, a little skeptical, but I sat down and I did it, and 10 minutes later I did this because I do it religiously, because it's weird when you don't have feeling in your fingertips, because you feel this and you don't feel what probably most people feel. It just feels like a dull reaction. And so I went like this, and I rubbed my fingers on my pants, and I immediately I couldn't even control myself. I started tearing up. I hugged the patient, and I told him that I am a client for life, and I have full and honest, sincere belief in this machine because I have seen the results. I can vouch that they are real, and I invite anyone who's having issues whatsoever to investigate this.
Okay, let's move it up and do your head this time.
Okay.
Good?
Yep, we're good. Yep.
Okay. Hi, as you can see, PEMF changed Melissa's life, changed my life, and if you're dealing with a health issue, it can possibly change your life too. So if you'd like further information to find out more, you can call me at my office. The number here is area code 734-728-5533, or feel free to visit our website, which is PEMFcenters.com, PEMFcenters.com.